Number 1 po ay COPD is reversible and tends to happen gradually.
And what's the answer? The answer is, anyone? Is it true or false? 5, 4, 3, 2, 1. The answer is COPD is reversible and tends to happen gradually. The answer is false. Okay? Why it's false? Because the correct is it happens gradually. It happens gradually. It's true. Because sabi nga natin kanina, when things happen sudden in onset, it's acute. Pero merong chronic. So therefore, it happens long time. So gradually, it's yes. However, what makes the statement false? The term reversible. It's not reversible. Being that chronic, it's not reversible. So pag may nabasa kayong mga diagnosis na may term na chronic, okay, and then may term na nakalagay reversible, then therefore it's false. Okay? Pag diagnosis pinakita chronic, tapos may binapakita ito reversible, then the answer is false. Okay?
Then
the thin blue water is used to describe patients with A. Pulmonary hypertension. Sana laging ganyan kahit sa board exam, laging tama sagot.
Emphysema po.
Failure, chronic bronchitis, and emphysema. The correct answer is?
Emphysema yan, sir. Charot.
Ano sagot?
Emphysema.
Emphysema?
Emphysema.
Sino nagsabing
bronchitis?
Sino nagsabing emphysema? Okay. So, meron tayong dalawang klase dyan. So, we have blue bloaters and the pink puffers. Okay? Kasi, there are two basically tawag dito category of COPD, which is kanina nga yung chronic bronchitis and that of the emphysema. Okay? Now, sino ang blue bloaters? Okay? Si chronic bronchitis ba o si emphysema? Si chronic bronchitis, blue bloater siya kasi nga, generally, yung mga pasyente na may COPD caused by chronic bronchitis, sila ay color blue. Okay? Nagkukulay asul sila or nagkukulay violet. Okay? Why do they have have that particular color? They have that particular color kasi there is a poor delivery of oxygen sa katawan nila. With the chronic bronchitis, okay, constricted, okay, since there is constriction, okay, ang nangyayari dyan ay poor ang pasok ng oxygen to your lungs. So when there is a poor pasok ng oxygen to your lungs, there is a poor delivery of oxygen all throughout your body, which makes your body kulay blue. Okay? Now, yung emphysema, sila ang tinatawag natin na pink puffers. Bakit sila pink puffers? Because they do not, okay, despite of being kulang sa oxygen, they do not manifest bluish discoloration or cyanosis. Why? Kung kanina sa chronic bronchitis, there is this constriction, okay? There is this constriction of what? Of your bronchus or your bronchi. With the emphysema, okay, ang nangyayari sa emphysema is that you have dilated bronchus. So, ibig sabihin, what happens to that is nakapasok si oxygen. So, kung nakakapasok si oxygen, nakakapagpasa ka pa rin ng iyong oxygen all throughout the body. However, there is a poor gas exchange. Kasi nakakapasok si oxygen, pero in exchange of the carbon dioxide, hindi na siya nakakalabas ng katawan. Kasi hindi siya nakakalabas ng katawan na perfectly. Kasi hindi na na-expel out ng katawan through exhale ang iyong carbon dioxide. Kaya naman siya pink puffer. Kaya usually, ang advice natin kapag ikaw ay may emphysema, COPD, nagpa-pursed lip breathing ka. Paano pursed lip breathing? You inhale through your nose to 2 seconds and then you exhale through your mouth 4 seconds. It should be double the time you inhale yung exhale mo. Yun yung pursed lip breathing. Okay? So the correct answer in number 2, ang iyong blue bloaters ay chronic bronchitis. Next question. A patient is newly diagnosed with COPD due to chronic bronchitis. You are providing education to the patient about this disease process. Which statement by the patient indicates they understood your teaching about this condition? A. If I stop smoking, I will cure my condition. B. Complications from this condition can lead to pulmonary hypertension and right-sided heart failure. C. I am at risk of low levels of red blood cells due to hypoxia and may require blood transfusion during the acute illness. D. My respiratory system is stimulated to breathe due to high carbon dioxide rather than low oxygen levels, as with people who have healthy lungs. What's the correct answer? Anyone? Yung gumawa ng tanong. B. Char? Ano ba to? Si Andre Char daw eh. What's the answer? The answer is? The correct answer is letter B. Okay? First is, let's eliminate. If I stop smoking, it will cure my condition. It will never cure your condition. It will only, what? It will only halt the progression of signs and symptoms. Ibig sabihin, mapipigilan o mapapabagal niya lang yung paglala, but it can never cure. Because remember, smoking cessation is not a treatment. Okay? So it can never cure. Letter C, I'm at risk for low levels of red blood cells due to hypoxia and may require blood transfusion during acute illnesses. Why it's wrong? Because your problem is not your RBC. Your problem is your lungs. So, meron kang enough na blood. Diba? Ang problema mo is oxygen. Okay? So, oxygen will never be answered by blood transfusion kapag ang problema mo ay lungs. Okay? Your problem with red blood cells will only be, your problem with oxygen is masasagot lang ng blood transfusion kung ang dahilan ng pagkakaroon ng low oxygen supply mo sa katawan is that you have low red blood cells which delivers your oxygen all throughout the body. But in this scenario, hindi mo problema ang amount or yung quantity ng red blood cells mo. Therefore, you are not required or you will not be advised for blood transfusion, but instead, oxygen medication. Letter D, my respiratory system is stimulated to breathe due to high carbon dioxide levels rather than low oxygen levels, as with people who have healthy lungs. Ano ba ang nagtitrigger ng inyong paghinga? What triggers your paghinga? Okay, so the correct answer, yes, it's carbon dioxide that triggers your paghinga. Now, the answer is why it's false. Kasi ang sabi nga, as with people who have healthy lungs, my respiratory system is stimulated to breathe due to high carbon dioxide levels rather than low oxygen levels, as with people who have healthy lungs. It is wrong or it is false because normal people, okay, normal people without complication or without COPD problem, ang nagtitrigger na talaga ng kanilang paghinga ay carbon dioxide. Okay? So, hindi dahil nagkaroon lang sila ng COPD, kaya ang carbon dioxide naging triggering factor ng paghinga nila. Noon pa man, normal pa lang, regular pa lang, ordinaryo pa lang, carbon dioxide na talaga ang triggering factor ng paghinga. So that's the reason why this choice is false or wrong. Okay? Kasi, di ba binanggit nga natin, ang pasyente mo nga dito ay may COPD due to chronic bronchitis. You are providing education, which statement by the patient indicates they understood your teaching about this condition. So, ibig sabihin, if you have COPD, okay, yung paghinga mo is still triggered by carbon dioxide, but it has been, kahit pa bago ka magka-COPD, carbon dioxide talaga nagtitrigger ng iyong paghinga. Okay? Now, letter B, complications from this condition can lead to pulmonary hypertension and right-sided heart failure. Why? It may lead to pulmonary hypertension because doon sa gumawa na question, why? Why? Remember, when you have COPD, okay, ano nangyayari? When you have COPD, initially, nagpupunta muna siya sa bronchoconstriction. And then eventually, bronchodilation. Tama? So therefore, the blood vessels and the vasculature of your lungs are no longer capable of contraction. Tama? Now, if it's not able to do contraction, remember your blood is being pumped by your heart towards your lungs for oxygenation and for gas exchange. Tama? Pero, para makabalik ang blood, pabalik sa puso through the pulmonary arteries, dapat vasculature ang iyong blood vessels sa lungs. But, you have COPD. Your lungs is not vasculature vasculative anymore. So, hindi masyadong nakakabalik ang blood and water from the puso na pumunta sa lungs, from the lungs, pabalik sa puso. Therefore, nagkakaroon ng retention doon ng fluids and blood. And that leads for you to have pulmonary hypertension. Okay? Now, paano naman sir nagkakaroon ng right-sided heart failure? Nagkakaroon ng right-sided heart failure kasi sabi ko nga sa inyo, di ba? Ang inyong COPD would lead for you to have una, vasoconstriction and later on, vasodilation. Kapag ang lungs mo is vasodilated na, balikan natin kanina, mas malaki na yung diameter. Pag mas malaki na yung diameter, mas magpapump ang puso mo. Tama? Now, what chamber of the heart delivers blood to your lungs? The answer is your right side. Basically, your right ventricle. Right ventricle. O nga, tama. Your right ventricle. Right ventricle to pulmonary aortic valve to your pulmonary artery to your lungs. Tama? Pulmonary vein rather. Pulmonary vein. Diba? Now, kapag malaki na ang diameter ng blood vessels mo sa lungs and the lungs itself because it's bronchodilated or vasodilated, it would require for your heart to pump stronger. At kapag paulit-ulit na nagpa-pump stronger siya, okay, remember your heart is made up of muscle. Nagiging muscled siya lalo. At remember, kapag nagiging muscled ka, medyo mas mahina yung movement mo. Kaya kung makikita nyo, yung mga maskuladong lalaki, makikita nyo, medyo hirap na silang tumingin sa kanan, sa kaliwa because built na yung muscle nila, yung nuchal muscle nila. So, anong nangyayari? Ang movement nila buong katawan. Diba? Minsan hindi nila naaabot ang likod nila kasi nga masyadong muscles. So, same with the heart. Okay? Kapag nag-pump siya, okay, to adjust for the increased diameter, ang nangyayari sa heart mo, nagiging muscled ang heart mo. At kapag naging muscled ang heart mo, that causes right-sided heart failure. So that's how letter B is the correct answer for the question number 3. Do you have question? None? Next question. Huh? Kayo, puro kayo wala. Pag kayo nag-board exam, alam nyo ba ang pinakamalaking parte ng board exam is medical surgical, nurse practice 2, and nurse practice 3, and nurse practice 4. Lahat yun medical surgical. Pag yan, hindi nyo seryoso, nako, sure ball yan. Mais kayo. Walang tanong, ha?
Opo.
Hindi nyo sineryoso yung report. Anong servo? Ano servo? Ano yun, be? Anong servo? Pato ng bronchitis po. Ano daw? Don't worry. Sabi ko naman sa inyo, Mitch. Oo nga. Actually, lahat ng pathophysiology nyo. Anyways, paano ba? I'll be reporting pa rin naman, okay, doon sa mga certain diseases. Pero hindi ko na itatakal yung buo pathophysiology kasi I was expecting na ang gagamitin ko sana yung pathophysiology na gagawin ninyo. So I will just be highlighting some good points na madalas lumalabas sa board exam. Okay? So para doon pa lang mag-dwell kayo at may matandaan kayo out of your medical surgical. Okay? Next reporter, cystic fibrosis.
So, ayun po.
Sir.
Yes?
Sige. Sir, tanong ko lang, Eunice, nabago na ba yung
Oo, Ben,
file? Kasi sige. Salamat.
Thank you.
So, ayun po, cystic fibrosis. So, ayun, what is cystic fibrosis nga? So it is the most common fatal autosomal recessive disease among the Cauca- Caucasian population. An individual must inherit a defective copy of the cystic fibrosis gene. So galing dun sa sa isa dun sa parent. So ayun, although cystic fibrosis was once considered a fatal childhood disease, approximately 38% of people living with disease are 18 years of age or older. Next po. So sabi diyan, the frequency of cystic fibrosis is in the 1 in 2,000 to 3,000 live births. And there are approximately 30,000 children and adults na meron nga ng disease sa United States. So although cystic fibrosis was once considered a fatal childhood disease, approximately 38% of people living with the disease are, ayun, ulit lang pala, 18 years of age or older. So sinasabi lang po dyan sa cystic fibrosis nga po, hereditary disease siya that affects doon sa lungs and digestive system. So yung body, nagpo-produce siya ng thick and sticky mucus that can clog doon sa lungs and obstruct the pancreas. So, yun, it can be life-threatening din po. So, sinasabi na yung taong may cystic fibrosis na condition, nagtitend siya to have a shorter life than dun sa normal lifespan. So, next po. So, ayun, etiology. So, origin, first recognized as a separate disease entity in 1938 when autopsy studies of malnourished infants distinguished a disease of mucus plugging of the glandular ducts termed cystic fibrosis of the pancreas from others with celiac syndrome. So, yung causative agent niya is Staphylococcus aureus, Haemophilus influenzae, tapos Pseudomonas aeruginosa. Next po. So yung risk factor niya is family history, tapos white people of Northern European ancestry. Next po. So yun, sign and symptoms niya is frequent chest infections, severe cough, wheezing or shortness of breath, abnormal bowel movements, difficulty gaining weight, and for most men, infertility. So, yung diagnostic niya is sweet test tapos newborn screening. So, yung sweet test daw po, mini-measure niya yung concentration of chloride that excrete doon sa sweet. So, ayun, ginagamit siya to screen for cystic fibrosis nga. Ayun, next po. Ayun, clinical manifestation. So, ayun, pulmonary manifestation of disease include productive cough, wheezing, hyperinflation of the lung fields on chest X-ray, pulmonary function test results consistent with obstructive airway disease. So, ayun, colonization of the airways with pathogenic bacteria usually occurs in early life. So, yung Staphylococcus aureus, tapos yung Haemophilus influenza, common organism siya during early childhood. As the disease process, yung Pseudomonas aeruginosa ultimately isolated from the sputum of most patients. So yung upper respiratory manifestations of the disease include sinusitis and nasal polyps. Next po. So ayan, non-pulmonary clinical manifestation naman include gastrointestinal problems, dyan sa pancreatic insufficiency, ganun. Tapos, genitourinary problems, dun sa male and female infertility, tapos clubbing of the extremities. Next. Then, dito tayo sa assessment and diagnostic findings. So, elevated results of a sweat chloride concentration test along with clinical symptoms consistent with the disease. Repeated sweet chloride values of greater than 60 MEq per liter distinguish most individuals with CF from those with other obstructive diseases. A molecular diagnosis may also be used in evaluating common genetic mutations of the CF gene. So, medical management, ayun, bronchodilators, differing pulmonary techniques, inhaled mucolytic agent, or N-acetylcysteine, tapos anti-inflammatory agents, supplemental oxygen, lung transplantation, tapos gene therapy. Next po. So, ayun, nursing management na. So, assessment, signs and symptoms, tapos family health history. So, yung diagnosis niya is impaired gas exchange, ineffective airway clearance, imbalanced nutrition, less than body requirements, deficient knowledge, and infection. So, yung planning is maintain optimal gas exchange, proficient in using effective airway clearance therapies to clear secretions on a daily basis, maintain clear open airway, tapos maintain adequate nutritional status or demonstrate yung weight gain on a trajectory to adequate nutritional status. Tapos free of signs and symptoms of malabsorption, verbalize yung understanding of disease process, then improvement in infection and suppression of bacterial growth. Next step. So yung intervention is assisting the patient to manage pulmonary symptoms and to prevent complication of CF. Promote removal pulmonary secretion, chest physiotherapy, emphasize the importance of an adequate fluid and dietary intake to promote removal of secretions and to ensure an adequate nutritional status. Next po. So, ayun yung evaluation niya. Ayun. So, patient maintained an optimal gas exchange as evidenced by oxygen saturation of 90% or greater. Arterial blood gases, tapos within the client's usual range. So, relaxed breathing, baseline heart rate, tapos alert response, mentation, and no further deterioration in the level of consciousness. Patient is proficient in using effective airway clearance therapies to clear secretions on the daily basis, as evidenced by decreased work of breathing and improved pulmonary function. Tapos, patient maintained a clear open airway, as evidenced by normal breath sounds. Tapos, normal rate and depth of respiration. Patient maintain an adequate nutritional status or demonstrate weight gain on a trajectory to adequate nutritional status. Patient is free of symptoms of malabsorption. Tapos patient verbalized understanding of disease process. And patient has an improvement in infection and suppression of bacterial growth, as evidenced by decrease in a cough, mucus production to baseline, normothermia, and normal white blood cells count. Next po. Oh my God. So, ayun po. Pathophysiology. So, ayun. So, yung father and mother. So, sinabi nga dyan, may, mutated, CFTR or cystic fibrosis transmembrane conductance regulator gene. So, ito po, yung CFTR gene na to, para ma-build up niya yung tick ng mucus. Then, na nagpo-provides ng protein. Tapos, magkakaroon ng reduced quantity or function of CFTR protein. Then, defective ion transport. Kasi, yung pine-prevent niya yung usual of chloride ions and water into and out of the cells. Tapos magkakaroon ng Ito palang ayon ano na to, yung protein function, nag-ano siya as a channel across dun sa membranes of cells para mag-produce ng mucus, ng sweat, saliva, tapos tears. Tapos, magkakaroon na nga ng airway surface liquid depletion. Then, magkakaroon ng defective mucociliary clearance. So, itong defective mucociliary clearance, so yung conducting system niya is yung nose nga, yung trachea, yung bronchi. So, nagiging impaired na siya. Pero, sabi, hindi naman porket, mucociliary clearance, impaired na siya, ganun. So, tatlo yan, under of defective mucociliary clearance, merong mucus obstruction, infection, and inflammation. So, itong mucus obstruction, infection, inflammation, nag-occur siya dito sa scaling kasi itong mucus obstruction, binablock niya yung narrowed air passage para mahirapan na yung tao na huminga. Tapos ayun, magkakaroon siya ng mang-fear, ganun. Tapos, in stage niya, lungs disease po. So, yun lang po. Thank you.
Question. Cystic fibrosis is a genetic disorder that causes the endocrine glands to work incorrectly. The answer is what's the answer? The answer is true. What makes the statement true? It's a genetic disorder. Checked. And endocrine gland is being affected. That's the reason why meron tayong altered mucus consistency. Okay? So the number one, the correct answer is A. Number two, you are educating the parent of an 8-month-old who was recently diagnosed with cystic fibrosis. About the disease, you explain to the parents that the child has a gene mutation on the blank. The gene that is specifically mutated is called what? A. Endocrine glands, HBGS gene. Exocrine glands, CTFR gene. Endocrine glands, chromosome 21. Exocrine glands, HTT gene. What's the correct answer? Okay. So the correct answer, balikan niyo yung question number 1, endocrine glands. So dapat endocrine din ba? Ha? Ano daw? What's a... Oh, and then, anong glands? What's the correct answer? What's the correct answer? Okay. So, kapag sa gantong question, okay, Abesamis, you're correct. Okay? The affectation of the cystic fibrosis is your endocrine glands because basically it is where your CFTR gene is vastly located. But the presentation usually happens to your exocrine glands. Okay? So the correct answer is B. Why? Letter A, endocrine glands, pwede naman sana. But HBGS gene is hemoglobin. Okay? So basically, it has something to do with your red blood cells. Letter C, endocrine glands, pwede naman yung endocrine glands. However, chromosome 21, you don't have problem with your chromosome, you have problem with your specific gene. Your chromosome 21, it has something to do with your, ano nga ba? Down syndrome, ang chromosome 21. Okay? When you read something about chromosome 21, it is associated with Down syndrome. Okay? Exocrine glands, pwede naman sana. However, you have HTT gene. What is HTT gene? HTT gene, kung hindi ako kung hindi ako nagkakamali, it's Huntington or Huntingtin gene, which is specifically its function is it has something to do with protein, but it has no specific functions. Pero binabanggit ng Huntington or Huntingtin, I'm not sure na ha, matagal ko na hindi nababasa to eh. It has something to do with your neurons. Neurons in relation to the message impulses. Okay? So the correct answer is B, exocrine glands or exocrine glands CFTR gene. Okay? Next question. Number 3. Cystic fibrosis is an autosomal recessive genetic disorder. Which option below best describes what most likely happens for a child to develop this condition? A. One parent who is a carrier of the mutated gene has to pass it to the child. B. One of the parents has to have cystic fibrosis in order to pass it to their offsprings. C. Both of the parents must have cystic fibrosis in order for the child to develop it. D. Both parents who are carriers of the mutated each pass one mutated gene to the child. What's the correct answer? Sure? The answer, anong mga sagot? Okay. So, balikan natin. Sabi, anong generally sagot nyo? May D? Wait lang. Saan ko ba makikita yung messages? Ano to may E, D? May A, D, 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 D. Lahat ha, nakakatama ng sagot ha. The answer is D. Now, bakit D? Sabi, it's autosomal recessive genetic disorder. First, pag sinabi nating autosomal, anong autosomal? Yes, it's a chromosome. Autosomal, it's chromosome. Pero pag sinabi natin autosomal, it has nothing to do with sex chromosome. Okay? Now, kapag sinabi natin recessive, okay, pag sinabi natin recessive, ibig sabihin are not manifesting. Tandaan nyo, may dalawang klase, dominant and recessive. Pag sinabi natin dominant genetic, okay, or autosomal dominant genetic, ito yung may mga manifestations. Now, if it's recessive, walang manifestations. So, kaya naman siya letter D kasi yung parents niya, the mother and the father, they both have autosome, okay, of your fibrosis or CF fibrosis. However, both of the parents do not manifest any signs and symptoms because the autosomes they have for the cystic fibrosis are both recessive. So, ibig sabihin, kung ang kailangan natin sa cystic fibrosis ay 20, like for example, 46, sex chromosomes are 46, 22 na autosomes, for example, 22 pairs of chromosomes, ang meron lang si father, 11. So, walang kapares. So, hindi siya magiging cystic fibrosis. Si mother, meron lang din siya, 11. So, walang kapares kasi dapat 22 nga. So, si mother, recessive. However, if father and mother nag-meet, nag-sex, nabuo si baby, yung 11 ni father, mapapattern kay baby. Yung 11 ni mother, mapapattern din kay baby. Therefore, si baby, meron na siyang 22 na autosomes. Now, magre-release na siya ngayon ng manifestations. The question is, sir, yung cystic fibrosis ng baby, recessive pa ba? Okay. It is still considered recessive. Why? Kasi nga, nanggaling siya sa both parents na recessive. Okay? So the CF cannot be tagged as dominant because nanggaling siya sa recessive. However, okay, yung signs and symptoms niya nga lang dahil both ng sa father at sa father pattern niya, nakuha niya, dominant na ang signs and symptoms niya. Okay? So, nagkakaroon na siya ng sintomas ng cystic fibrosis. So, chances are, pag siya naman, nagkaroon siya ng asawa na may cystic fibrosis din, and then may manifestations, okay? Yung anak nila, magkakaroon likely din ng manifestations. Yung anak nila, ang dominant. Kasi kung asawa niya ay dominant cystic fibrosis din, then yung baby niya, dominant, hindi na recessive. However, there is a less chance na nagkakaanak ang cystic fibrosis. Why? Because one of the signs and symptoms ng cystic fibrosis is sterility or pagkabao. Okay? Why? Kasi nga, yung mga mucus, yung mga fluids, pinapathik niya. Remember, ang similya ng lalaki, okay? Meron siyang tinatawag na, tawag dito, di ba, merong semen and sperm? Baka akala nyo parehas ang semen at ang sperm. Ang sperm, ito yung mga motile, okay? Motile na cell. Ang semen, these are the fluid carrier. So, because of the cystic fibrosis, yung semen, okay, ang nangyari sa semen, nagiging thick siya. So kapag thick, hindi magiging motile ang inyong sperm cell. So hindi siya makakalangoy. So hindi makakabuo. So yun yung general theory. However, most of the cystic fibrosis kasi daw, hindi siya, ilang taon namamatay ang cystic fibrosis madalas, Andre? Base sa report mo kanina?
Po?
Hanggang ilang taon lang usually ang cystic fibrosis?
18, ano po? 18.
Okay. So usually, yung mga may cystic fibrosis, hindi daw sila nagtatagal. Pero may general average pa rin sila ng lifespan na 44 years. So, ito yung medyo nakakagulo sa akin. Estudyante pala ako, magulo na to sa akin. Kasi they are mentioning na hindi nagtatagal pero may average na lifespan ka na 44 to 46, I think. So, pero generally, yung mga may cystic fibrosis, hindi sila nagtatagal because of the infection. Madalas sa Pilipinas, they are not even reaching 12 years old. Okay? Because sa 9 years old age pa lang nila, massive na yung infection nila. Okay? So, hindi mo na talaga aasahan na magkakaanak sila kasi yung life nila, hindi naman ganun ka nagpo-prolong. And if nagpo-prolong naman and active ang kanilang cystic fibrosis, then sila ay nagkakaroon naman ng sterility. So, madalang kang makakita. Kung meron man, okay, I'm not sure kung meron man. Kung meron man, kung meron man, wala pa ako narinig na pinanganak na cystic fibrosis dominant gene disorder. So, madalas it's recessive kasi nanggaling sa both parents that have recessive autosomes for CFTR. Nagets ako? May question? Parang di naman kayo nakikinig eh. Okay, question, next question. Okay, sige, pneumonia.
So, ayun po, pneumonia. Definition. An inflammation of the lung parenchyma that is caused by microbial agent. Pneumonitis is a more general term that describes an inflammatory process in the lung tissue that may predispose a patient to or place a patient in risk of microbial invasion. As pneumoniae, a gram-positive organism that resides naturally in the upper respiratory tract, colonizes the upper respiratory tract and can cause disseminated invasive infection. Pneumonia can be classified into 4 types: community-acquired pneumonia, healthcare-associated pneumonia, hospital-acquired pneumonia, and ventilator-associated pneumonia. So yung community-acquired pneumonia, it's acquired outside of the hospital. Then yung healthcare-associated pneumonia naman acquired when you are in a hospital. Tapos kapag naman yung hospital-acquired pneumonia refers to any pneumonia contracted when patient in hospital at least 48 to 72 hours after being admitted. Then yung ventilator-associated pneumonia naman occurs in people who are on mechanically ventilation breathing machines in hospital. So etiology, origin noted throughout human history. Early Greek civilization, discovery of bacteria, 1881. Causative agent is the Streptococcus pneumoniae. Then yung risk factor predisposing advanced age diseases, cancer, COPD, then yung mga immunosuppressed patients. Then precipitating is smoking, alcohol intoxication, prolonged immobility, and shallow breathing pattern. Then yung perpetuating is respiratory therapy with improperly cleaned equipment and transmission from healthcare providers. Next natin is yung mga signs and symptoms. Symptoms which is pyrexia or fever, upper respiratory tract infection, deep breathing and coughing, tachypnea, respiratory distress related tachycardia, dyspnea, and sputum production. Yung mga diagnostics is CBC, chest x-ray, sputum test, and pulse oximetry test. Then yun yung medical management. Antibiotics, penicillin sensitive, which is penicillin, amoxicillin, ceftriaxone, cefotaxime, and penicillin resistant, which is levofloxacin, vancomycin, and moxifloxacin, and antihistamines. Yung treatment naman is breathing treatments such as nebulized breathing, oral steroids, or inhalers. Next natin is assessment, signs and symptoms, or past medical history. Then yung mga diagnosis is ineffective airway clearance, risk for infection, impaired gas exchange, risk for decrease in fluid volume, imbalanced nutrition, less than body requirements, fatigue and activity intolerance, and deficient knowledge. So yung planning is improve airway patency, restore breathing pattern, increase activity, retain normal thermoregulation, maintenance of proper fluid volume, maintenance of adequate nutrition, and learn more about the disease. Next is, yung intervention naman is teach and assist patient with proper deep breathing exercise, elevate head of bed, change position frequently, maintain adequate hydration by forcing fluids to at least 3,000 ml per day unless contraindicated. Assist and monitor effects of nebulizers, treatment, and other respiratory physiotherapy. Encourage ambulation and administer medications. Next naman is yung evaluation. Patient maintains an effective breathing pattern as evidenced by relaxed breathing at normal rate and depth and absence of dyspnea. Report or demonstrate a measurable increased intolerance to activity with absence of dyspnea and excessive fatigue and vital signs within patient's acceptable range. Patient will maintain optimal gas exchange autostat at 99%. Patient will have temperature of 37 degrees Celsius and patient will know more about the disease and initiate necessary lifestyle changes. So next po is yung pathophysio. Sir, okay lang po ba kung iba pong pato yung gamitin ko? May similarity din naman po. May dinagdag lang na konti. So, ayun, yung pathophysio. Kita po ba?
Anes,
Sir, okay lang po ba?
sinong gumawa ng pathophysiology nan?
Sir, ako din po.
Ha? Sino?
Kami po. Ako po pala. May
Ayan?
similarity din naman po, sir. Doon sa ginawa po ni Andeng, may dinagdag lang.
Okay.
Ito po yung kay Andeng. So, ayun po.
Okay, sige, go.
Yun po. Yung smoking, alcohol, and aging, sila yung mga risk factors. So, yung smoking, alcohol, and aging, pinapabilis nila yung impairment ng defense mechanism ng body or pinapalis nila yung effectiveness. So, meron tayong tatlong defense mechanism. Yung mucociliary defense, na yung silya sa ilong or pwede sa lalamunan. Then yung macrophage, kasi macrophage, then yung gag or cough reflex kapag nakaka-aspirate or sa inhalation ng pathogen. Kasi, di ba yung pagkain or kinakain natin, may bacteria yon. Yung respiratory connected siya sa digestive natin, kaya yung pagkain, pwede siya mapunta sa respiratory tract na imbis na sa tiyan natin, pwede siya mapunta sa lungs. Kaya yung bacteria na galing sa pagkain na inintik natin, yun yung pwede mag-cause ng pneumonia. Ang gulo. Again po, yung smoking, alcohol, aging, pinapalis nila yung defense mechanism. Kaya pag naka-inhale or aspirate ng pathogen, mape-penetrate nun yung lower respiratory tract. Yung lower respiratory tract po natin is sterile, kaya dapat po wala siyang bacteria. Dahil nga si bacteria nandun sa lower respiratory tract, doon na rin siya magpaparami, which is, yun nga, magkakaroon ng microbial colonization. Then, ang mangyayari, yung mga pathogens or yung bacteria or yung microbes na yon, magre-release ng endotoxins. Ay, yung endotoxins, sila yung magkakos ng tissue damage. So, dahil nga may tissue damage sa alveoli, may dalawang cells na magre-response, which is yung macrophage at saka yung mast cells. So, yung macrophage, magre-release siya ng TNF alpha or tumor necrotic factor alpha, interleukin 1, interleukin 6, and interleukin 8. Yung apat, nagbind sa prostaglandin. Nagbind sa prostaglandin E2. Tapos, in-stimulate niya si hypothalamus. Di ba yung yung thermoregulation po natin nasa hypothalamus. Kaya nagkakaroon po ng elevation sa temperature. Kaya po nagkaroon ng fever. Then, yun nga po, di ba sabi po natin na yung fever, hindi naman po lagi siyang masama, na pwede yung fever na yung defense system natin is nilalabanan yung pathogens natin sa katawan. Then, next po is yung sa mast cell. Yung mast cell, nagre-response din po siya sa inflammation, magre-release siya ng histamine at saka ng mga leukotrienes. So, si histamine po, tsaka po yung si histamine po together with TNF-A at saka po yung mga interleukins, magkukos sila ng increased dilation of blood. Ito po, magkukos sila ng increased dilation of blood vessel and vascular permeability. At dahil na may increased dilation at vascular permeability na nangyari, mag-increase din po yung blood flow. Pero dahil nga may vascular permeability, meaning may mga cells na nagko-cross doon sa blood vessels, which is yun po yung mga WBC, complement proteins, RBC, and fibrins. Kaya sila magka-cross kasi nag-respond sila sa inflammation, pero imbis na mas makabuti, mas makakasama pa siya kasi magkakaroon ng alveolar flooding. Kasi nga po, di ba, yung alveolar flooding natin, yun nga, imbis na oxygen and carbon dioxide yung nandun sa alveolar, na sila yung nag-exchange doon. Ang nangyari, ang nandun po, is yung yun nga po yung nabanggit ko kanina, which is yung WBC, complement proteins, RBC, and protein. Kaya po may impaired gas exchange na nangyari. Then kapag nagkaroon po ng impaired gas exchange, magdi-decrease po yung oxygen, kaya po nagkakaroon ng hypoxemia. Then, yung next po is the leukotrienes. Yung leukotrienes po, tumutulong siya, So, ayun yung leukotrienes, tumutulong siya sa chemotaxis. Magpupuntahan yung mga WBC, complementary proteins, RBC, and fibrins doon. Then, yung mga leukotrienes po, nagpo-promote ng bronchospasm or constriction of bronchioles. Dito na. Then, di ba po nagtitiken yung mucosal layer, then nagkakaroon ng hypersecretion of mucus. Then, pag nagkaroon po ng secretion of mucus, hindi naman po lahat nag-excrete. Yung iba pwedeng mag-cause ng mucus plug. Then, pag may mucus, nag-cause ng irritation sa certain part po ng lungs, which is the carina, kaya nagka-coughing po. Then, so, ayun nga, may constriction, may mucus, nagkakaroon ng further narrowing sa bronchiole, kaya nagde-decrease yung airflow. Kasi magkakaroon ng resistance, konti lang yung pumapasok, naiipon, tapos, hindi na ilalabas yung decrease yung airflow, kaya nagkakaroon ng hyperventilation and nagkakos ng tachypnea. Then, kapag walang enough na oxygen, ang natural response kasi natin, di ba, habulin natin yung hininga natin. Kaya pag hinabol natin yung hininga, masyadong nataas yung respiratory rate, pero hindi enough yung oxygen. Kumbaga, masyadong shallow yung breathing, hindi deep. Then, kaya nagkakaroon din ng crackles and wheezes dahil yun sa mucus. Kasi, yun nga po, according po dun sa description ng crackles and wheezes na may nag-obstruct sa airflow, dahil nga may bronchial wall, narrowing tayo, tapos takip niya, the more na hinahabol natin yung hininga natin, the more na nagke-create yung crackles and wheezes na sound. Kasi nga may mucus and narrowing. The next po, yung tatlong eucotrins po, apat pala. Yung apat po ng eucotrins, ang tinatagay po nila yung endothelial cells. Pinapa-increase po nila yung capillary permeability. Kaya po ang mangyayari, may decreased pressure po sa loob ng capillary. Kaya ang mangyayari, magkakaroon po ng fluid leak or magkakaroon po ng increased fluid. Kaya po may edema. Ngayon, yung hypoxemia, tsaka tachypnea po, magre-result sa decrease lang compliance, tsaka yung edema, magre-result sa dyspnea. Pag hindi nag-comply yung lungs, mahirapan po huminga, kaya nagkakaroon ng shortness of breath. Yun lang po, sir.
Okay, thank you for that. I appreciate the pathophysiology of both yung gawa mo, Eunice, and yung gawa ni Andrea. Okay? So, questions. Which of the following pathophysiological mechanism that occurs in the lung parenchyma allows pneumonia to develop? What's the answer?
Ito lang pangalan.
Ang gagaling ah. Laging correct yung answer ah.
Chris. Kasi pinakilala ko tayo. Kailangan nag-consult. Pinag-consult. Sabi nga, pinakilala ko sa kayo. Akala ko talaga, ito ang kapat. Sabi ko lang nagbagit. Don't see me. Bago na sabi. Chris na yata. Wala na tawag sa Chris. Chris na. Wala na tawag sa nito. Oo, alam mo. Bigyan sa lang.
What's the correct answer?
Tapos pinakilala ko kayo, hindi dito. Ano ko talaga ito na kanina? Sinasabay niyo ng ito. Kasi, bumili sa samsang.
So the correct answer is inflammation. So, alam naman natin, ito nga yung tinanong dati before ni before pa, ni Migs, na yung Staphylococcus pneumoniae causes the pneumonia. Basically, it's correct. However, it is not the pneumonia that it is not Streptococcus pneumoniae which would cause pneumonia, because pneumonia itself is a general term which depicts or identify as the accumulation of water or fluid in your lungs. The pneumonia happens in the pneumonitis or inflammation of your lungs, which is causes by your Staphylococcus pneumoniae. Now, what causes for the pneumonia is the inflammation process. Kapag namamaga, nagiging hyperactive ang inyong lungs, which results for the goblet cells to produce much fluid, which causes for dapat plema. However, since hindi nagiging thick ang plema, nagiging water siya doon. Another thing is that because of the interleukins, because of the interferons, because of the TNF, okay, nagkakaroon ng massive, pooling of water from your vascular cells towards your lung, your alveolar sacs. So therefore, it causes your pneumonia. So ang pathophysiological mechanism nun basically is because of the inflammation. Kasi ang mga na-release natin ay mga inflammatory mediators. Okay? Atelectasis, what is atelectasis? Is the collapse. Bronchiectasis, anong bronchiectasis? Okay, bronchiectasis Ito yung mapag-aaralan nyo in the next tawag dito. Alam ko topic nyo rin ata ito eh. Basta it has something to do with, yes, dilation. Okay? Effusion, it is the pooling of water. Okay? Sir, kung pathophysiological mechanism, bakit hindi effusion? Bakit inflammation? Because remember, effusion may happen due to inflammation. Okay? Effusion may happen due to infection. Okay? But not always effusion may cause to pneumonia. It is always inflammation that may result to pneumonia. Kaya hindi effusion ang best answer. Okay? Next question. Next question. Wala na, isa lang question. A diagnosis of pneumonia is typically achieved by which of the following diagnostic tests? ABG analysis, chest x-ray, blood cultures, sputum, and sensitivity. What's the correct answer? Merong may D?
Ako Sprite sa likod. Para ano? Kalalabasan niya parang papa. Madalis ka sa parang Sprite.
The correct answer is B. Chest x-ray. Sir, bakit ganon? May nabanggit kanina na Staphylococcus pneumoniae. Okay? Dapat is sputum culture and sensitivity. Diba? Why it is chest x-ray? It is because exactly, contrary answer it, kita sa x-ray kung may tubig. What we are after is to test or to check whether the patient has pneumonia. We are not after to check what is the origin of pneumonia. If the origin of pneumonia is believed to be inflammation, therefore sputum culture and sensitivity may be ordered to check whether it's really Staphylococcus pneumoniae or some other reasons like coronavirus, like H1N1, okay? But since the question itself pertains only to pneumonia, then the best answer would be chest x-ray. Because sa chest x-ray, makikita mo agad whether the lung is fluid-filled or not. ABG analysis, why not ABG analysis? Because ABG analysis would only tell you the extent of pneumonia or yung severity ng pneumonia, which may result to either respiratory alkalosis or respiratory acidosis or further metabolic per se na. But not pneumonia basically. Blood cultures, because pneumonia is in the lungs, you are not to collect blood from the lungs. So it's not blood culture. So the correct answer is chest x-ray. Next question. A 79-year-old client is admitted with pneumonia. Which nursing diagnosis should take priority? A. Acute pain related to lung expansion secondary to lung infection. B. Risk for imbalanced fluid volume related to increased insensible fluid losses secondary to fever. C. Anxiety related to dyspnea and chest pain. D. Ineffective airway clearance related to retained secretions. So what's the correct answer? D. 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 Okay. The correct answer is D. Why? Because there is ineffective airway clearance dahil nga yung secretions is not effectively spelled out. For two reasons. First is, usually the pneumonia ng matanda is caused of bacterial pneumonia. If it's bacterial pneumonia, then therefore there's inflammation. So when there's inflammation, your passage is, the integrity of the passage is altered. Kaya naman nagkakaroon ng secretions retention. It's not acute pain because wala namang binabanggit sa statement that the patient experiencing pain. Okay? It's not risk for imbalanced fluid volume Because, remember, wala namang binabanggit regarding diet. And kung imbalanced fluid volume, it's not much hindi ganun kalaki yung reservoir ng lungs to conserve the water para hindi maging balanced in the rest of the parts of the body. So it's not correct. Anxiety related to dyspnea and chest pain can be a secondary choice, because knowing for a fact a 79-year-old with difficulty of breathing, they are anxious of what is the origin or what is the reason of their dyspnea. So that is a second choice. But the primary choice is ineffective airway clearance, because what we are talking about here is pneumonia, which pertains to your lung. So therefore, your diagnosis should focus on the lung. So letter D is the correct answer. Any questions? Okay. So I do understand na masyado kayo nabibilisan sa reporting. I'm sorry, but I expected much from how you would be presenting your report and your narrative, okay? Pero medyo may kulang, medyo konti pa, okay? So what I'm going to do tomorrow, we are to focus on MS tomorrow, and then Tuesday to Saturday, we are to proceed with our research. So tomorrow, I'll discuss the asthma down to your pneumonia, asthma, COPD, chronic bronchitis, CF, pneumonia. I'll be only focusing on some highlights of importance. For example, ano yung mga important na signs and symptoms? Paano yung nade-develop? I will just be mentioning it to you. And then what are the treatments and medications na common on each of the diseases? Just likely yun yung mga nalabas sa board exam. And then we'll proceed to the next group to report. Nasundan niyo ako? Okay, so let's cut the reporting now and let's meet tomorrow kasi medyo okay pa naman yung signal ko pero nababa yung bar. Okay, let's meet tomorrow. Chances are we are to meet tomorrow by 4 p.m. or I'll tell you kung mag-move tayo bukas. Alam niyo naman, medyo may shooting ako. So, next report would be cryptogenic organizing pneumonia or COP, bronchiectasis, tuberculosis, pulmonary embolism, and pneumothorax. Wait lang. Yung kapatid ko. Sir, yung narrative report, and eto na po bang reporting natin yung pagkukunan niyo po ng prelim grade namin o may exam pa po? Actually, di ba nangako naman ako sana sa inyo na hindi ako magpapa-exam. However, I believe kasi na kaka-renew yung pathophysiology. So I'm thinking to have a final, super final exam, pero sa finals na. Yung prelim and midterm, hindi ako magbibigay ng exam. Magbibigay ako sa super final exam. Wherein lahat ng sakit magkakasama doon. Okay? So that would be on January. Next reporting would be tomorrow after I discuss, reporting ulit tayo. Yun yung highest form of super saiyan. So, may question pa? Okay, so if there's none, let's call it a night. Let's see you tomorrow, 4 p.m. ulit. We are to process MS tomorrow, okay? And then research Friday and Saturday. Thank you. Happy dinner then. Bye.
wag na lang muna. Hintayin na lang ang hangin, nangayin ang salita.
Whoa, guys, hold up. Since when were there 5 of us?
What are you talking about?
Double 7. No, seriously, there's suddenly 5 of us.
That's absurd. 1, 2, 3, 4, 5. Holy shit.
That must mean one of us
Is an imposter.
But who?
Guys, let's have some reasonable discussion here. Who's this guy?
What?
Yeah, that's right. Actually, I don't recognize this man. Who is he?
Guys, it's me. I'm Ben.
Guys, it's me, I'm Ben.
No, you're not Ben, I'm Ben.
No, I'm Ben! That's what an imposter would say.
You are sounding mighty suspicious, sir.
Ben.
Sir.
Guys, come on. I've been playing PUBG with you for years. We've logged literally thousands of hours together.
But haven't we all logged thousands of hours together?
What? Are you seriously gonna side with this guy?
Guys. Come here. Whoa! Get back! Get back! Fucking stay back!
One of these two is an imposter.
Come on, Rowan. Make the right choice. You always do.
Well, that means a lot to me, Ben.
Well, it's really great to see
Thank
you
you
guys
so much.
rebuild that relationship.
Yeah.
That's awesome.
Guys, you can literally see the name above my head.
It's circumstantial at best. Come on!
This is outrageous. This is outrageous.
That's what Ben says. Ben says that all the time.
I literally just said that. Wait. I got it. Okay. Ask me a question that only I would know.
Oh, that's good.
Okay. Yeah. Okay. I'm gonna ask you a question that only Ben would know.
Great. Perfect.
What is my mother's middle name?
Well, I don't know. How would I know that?
Suspicious. Suspicious. Okay, Ben. What is my favorite video game?
Oh, f off.
PUBG.
Yes!
That's the truth.
He's the imposter!
God. No, guys, you can still raise me.
That was horrifying.
Ben! Oh, we almost lost you! Oh, we almost lost you, Ben. Oh, Ben. Oh, Ben.